Welcome to the next in our Meet the Speakers series here at CHATTcon 2021. First of all, the format of the conference completely flipped it. Everything's pre-recorded and you can go watch stuff now. We have two speakers here, Linda and Kathy, that I'm gonna first let them talk about how they met each other, the story of that, actually on this, super excited. And then we'll move into what it is that they each both respectively do while they're a part of the event, then what they're talking about, and we'll just kind of wrap up there. So, ball is in your court. Who wants to start us off on this story?
Kathy.
Hey, Linda. Want me to start? I will start.
I do.
So my sister is married to Linda's cousin, which is the short version. And for years I was hearing from Tom, oh, you should meet my cousin. She likes a lot of the things you do, the dog training. She has an agility place. And it's really, really interesting. And one year we got invited to my brother-in-law's family reunion. And we had just met some of her other family, or your other family, at a christening. So we went because we had such a great time at the christening. And Linda was there. And Tom introduced us. And Linda and I just started talking like we were old friends.
It's very true. And I'm from Connecticut, which is where Kathy lives, and my family lives. I'm in Ohio, and so it was just happenstance that I flew in for that particular family reunion, and we haven't stopped talking since. Everybody walked away from us. We were left, the two of us, the reunion's out here, and here we are, and it was great. So that's how we met, and then, of course, we had the commonality of medicine.
Yeah.
And we started talking about being a physician versus being a veterinarian, and that started a whole other conversation.
That's still ongoing to this day, right? It just picks up.
It really is. And that
was
the impetus, exactly. That was the impetus for the talk that we're doing with CHATTcon. Kathy and I have both been to all CHATTcons to date.
Yeah.
And at the end of every one, we said, if we got together, we have a convergence right here. Mm-hmm. And so here we are, and we're really excited because this topic is a passion for both of us. And behavior itself is a passion. And then within the medical setting, the time is ripe for the One Health idea, which is out there. They just really haven't done a lot with it in the two medical communities. But we're starting to take a lot from the human side, and interestingly to us as veterinarians, finally the medical side is seeing what they can learn and take from the veterinary side. And so this is really a focused growth area in both fields. And that's one of the reasons that we're so passionate about it, because as animal trainers, as a third point of the triangle, I think that we bring an even more unique perspective.
Yeah, we spent a lot of time at different conferences, whether it was the chat conference or the Clicker Expo, and talking about behavior and kind of an animal trainer's understanding of behavior and comfort level of their learner, and applying that in clinical settings, in medical settings, is very interesting. We kind of watched some of that develop with things like cooperative care in veterinary practices. And it was interesting how a lot of those principles will apply to medical settings.
Would each of you mind just giving a little bit for folks watching as to how you practice in medicine, what you do specifically? And even if that's all over the place, just a little synopsis of what your day-to-day is like, and like how you're interacting with behavior, maybe.
It is twofold, because I'm a family medicine physician, so I see patients, and I also teach residents. So in any situation, I may have two clients, patients who need education or explanation, interpretation, and residents. And there's so much behavior that goes into those, doctor-patient relationships, and how do you develop and foster them? How do you not get misunderstood while you're juggling all your other clinical responsibilities? So doing both of those things.
Is there specific training that's towards, like the psychology of is there any psychology training or human behavior training when you were prepping for that role?
Good question.
Prepping for the role as
family medicine.
So family medicine is an interesting specialty. It's only been a specialty since around 1968, 69.
Okay.
And I think we do primary care. And part of that curriculum does have a behavioral component.
Okay.
Which is fascinating because internal medicine is a corollary. They do a lot of primary care and subspecialized fellowships after a residency, but not so much of the behavioral component. So it's very integral into family medicine.
Okay. So did you pick up a lot of Go ahead.
Oh, sorry. I'm sorry. Right. I just wanted to say, I'm really interested because we really haven't talked about it. What about what you learn about the behavior of a resident who's right in that gray area?
Yeah. A lot of what I've learned about teaching, I've learned from really great dog trainers. I know Marty Levy is a speaker.
Mm-hmm.
And I've heard him speak a bit, and he's actually come to our hospital and done some faculty development.
Cool.
But he talks about one of his agility teachers, and you really learn to kind of meet the learner where they are and then help them grow. And when I was new attending, I often felt like, oh, well, you should know this. You finished medical school, you should know this. And so it really helped shape me as a teacher and make, I think, me a more patient teacher. Sometimes it is context because we'll interview for new applicants and the residents will be like, oh, Dr. Nurena treats us like dogs. I'm like, okay, give that a little context. As a reinforcement trainer, that would actually be a good thing. Not everybody would take it the way you mean it.
Yeah. And how about you, Linda? Your focus in medicine, veterinary medicine.
Yes, I was also board certified in, I will say, the equivalent of family medicine, companion animal medicine. And within that, there is a behavior component. What we didn't get in veterinary school or in the board certification was human behavior, which of course we need because we're dealing with the caretakers and we're dealing with the animal. The behavior that we got for animals, when I was in veterinary school, was not what it is now. It's much larger component at this point in time for all species. And they still, as far as I can tell, and I'm on the admissions committee at Ohio State Veterinary College, it's still, the human part of it is only there in terms of business, but not in terms of true psychology of behavior. Okay. So I think that we're missing the boat there in a lot of ways, but any case, so that's what I do, companion animals, and I also see exotics.
Very cool. For exotics, for someone that doesn't work with exotics like myself, can you give us some examples of what that includes? Maybe in the last year or two or whatever.
Small exotics. I'm not seeing the zoo animals that people might think of when I say exotics, tigers and that kind of thing. Although I have clients with bears and tigers, I do very little with them, as you can imagine. It's just not my specialty. Mm-hmm. But so I see the small furry mammals, so the ferrets and the rabbits, but I also see a lot of reptiles and I see a fair number of birds, although I'm not a bird specialist. So I pass those on to the veterinarians who are avian specialists.
Nice. Yeah, I think some themes here I've seen. I can't remember the title of the book, but I know there was on Bill Gates's top 5 books to read last year. One of them was just looking at how different areas of science, in short, are starting to realize, like, the more we talk amongst each other, even though we think we're separate, we're going to find a lot of commonalities. And so the theme there of saying, you know, like, I think that there's a little more opportunity, and what you all are doing is in a way, like setting the actual convergence of these things. And I think obviously that's the point of the conference, but I just want to praise you all for like coming together. Thanks for telling the story, but like we can see that it's been years, right, that you all have been trying to share ideas and like embody that convergence of these different areas. And that's how it's going to happen. Like the more we talk and do these sort of things, work together, the more it's going to actually converge together, and we'll find these sort of things that we can each learn from. So, so y'all met through personal, familiar sort of ties, and then start nerding out together and sharing things back and forth. From there, I guess, like, what are, maybe we can just tease and highlight some of the points in the talk, I guess, or where your current relationships brought you together in the convergence of all these ideas. Like, what are you currently talking about and maybe going to share at the conference? But if there's other things that you're talking about that aren't at the conference, like, what are those topics, you know? Like, where's the convergence right now?
I know, and Kathy, if I may just quickly, here's just to say, we have put out a few small talks, I think maybe 4 or 5 in all, that are anywhere from 3 to 5 minutes. I think the longest one is 13 or 14 minutes, where we talk a little bit about the tendrils that just came out of this approach. There are so many things that are so fascinating when we're talking about behavior at all, but within the medical setting. And we chose 2 bigger topics, trauma-informed care and the cooperative care, 2 big names, the former in human medicine and the latter in veterinary medicine, but they're coming together now. So, Kathy, do you want to talk about that a little bit more, or about our little topics? What is the Colombo Effect anyway?
That is that kind of that client, that patient relationship where there's so much more than just their chief complaint. And sometimes with continuity, you get to know patients. Sometimes they're feeling you out to see if there's a little bit of trust, because one of the things we talked about, the kind of the Colombo Effect, is that when you're leaving the room, you think the encounter's complete, and there's something else they're going to share. And we talked a little bit about how more often than not, that's the really critical stuff that may take some more time, because, you know, they felt out the encounter and they feel there's a little bit of trust there, so they can share a little bit more. We talk about trauma-informed care has some of its basis in adverse childhood experiences and some of the social determinants of health. One thing that kind of off camera, Linda and I talked about was some of the things like domestic violence and the link. There's domestic violence, there's child abuse, there's animal abuse, and there's a whole link coalition about that intersection. You know, so sometimes some of the things you're encountering are related to that, but just realizing trauma-informed care, you're realizing, I don't necessarily know why you're behaving the way you are, but let's get you feeling as comfortable as you can. Let's get your immediate needs addressed and give you the benefit of the doubt.
Yeah, that segue from there was the fact that another rabbit hole is the fact that animals can be traumatized and we don't even know it. And a couple of avenues there. One was wildlife. Are wildlife constantly traumatized? Do they live every day in a state of trauma? And I asked several people about this, and they said that there's a difference between trauma and aversive events. That perhaps wildlife, for instance, live a stressful life and they have aversive events occur, but does that go over into what we're calling trauma? So then how do you define trauma? And what is this day-to-day existence. So that was an interesting conversation, which I really personally want to take a lot further and get people in on a panel to discuss that kind of thing, because then I was going over into what we're now calling COVID canines, and which is just an extension of rescue dogs, we'll say for the moment. And are they in rescue because they were traumatized? In other words, can we assume that all rescue animals had some sort of trauma, which is how they ended up there one way or another in the first place? And if so, what do we do about that? And is that trauma-informed care, or in my world, should we rename it trauma-assumed care? That we don't know, we'll never know. And people, the best caretakers of a pet in the world sometimes they don't know that they've traumatized their pet.
Yeah.
They'd be horrified to realize that happened. And so those are some of the things that we talk about behind the scenes.
Yeah, I would love to be a fly on the wall for that panel discussion, because I'm the line between trauma and aversive, very interesting. I don't know. When you were mentioning it, I was trying to like conceptualize and like scroll through, all the readings that I've done on aversive implementations of and like different procedures, and I'm just like, I don't know where that line is. And so yeah, that's you also remind me of I don't remember what it was. I was scrolling somewhere, saw a video the other day, had it been on a TikTok or YouTube of some sort, can't remember, where you saw it was like a group of people. There was a pup there, looked to be at least 3-4 years old. So, but there was something that happened around the dog that made it like wince. And one person noticed that and said, "Oh my gosh." And the other people didn't really notice, but you could see like what looked like a little bit of empathy, like immediately from the owners, like being like, where did that come from? Right. And that's, I think that those like your accidental day-to-day behavior, like you're saying, you may not be aware of, may completely shape something or cause some sort of event, whether aversive or traumatic. And knowing how those develop and how those shape traumatic versus aversive events, and like where the line is and if there's a difference, would be really beneficial, so that you can start to then guide your instruction, your teaching around it and such, right? So that you can work to avoid those sort of things.
Yeah, and I think just quickly, an ancillary to that is PTSD, in that I am seeing now in the veterinary literature a case history of PTSD in an XYZ type of animal.
Okay.
There is great controversy about that, and you talk to people within the animal behavior situation who don't think that there is PTSD in animals, or if there is, it's rare. And the animals that are being talked about are usually animals such as elephants or whales, and that we have a different view of now with their emotions and the way they communicate and all of that. So you take that group of animals, and it's an interesting discussion, I think, and one worth having, but the veterinary medicine field is starting to glom onto it without having a larger discussion about the definition of it, and why would you say this animal has it, but this animal doesn't. And then they talk about soldiers, and how can multiple people from a battle unit come away, and 2 of them do end up with PTSD. And the rest of them may be on a scale, but there's some that walk away and say, well, yeah, what I do. Yeah. And what is that makeup? And so the transfer to animals is fascinating. And what is it, the chemical makeup of the brain? Yeah.
I'd like to, if you're up for it, connect you to a colleague, Abigail Calkin, that works in this area, that might be really interesting to chat with. As like a panel sort of thing, right? Just to bounce some ideas around. Yeah, this is cool. I need to get Abigail at this event, actually, because of some of the work that she does. Very cool. So this is going to be a fantastic, so first of all, it's already a fantastic talk because it's recorded. Remember, all this stuff's available for anybody that's watching. But But what I was getting at there is also like the progression of this. I think is going to be really interesting to watch for the coming years, where you all are going with this and the different discussions. So I also just want to thank you for converging and bringing things together. I really appreciate having you all at CHATTcon as well.
Well, thank you. It's nice to have such an event where there can be the exchange of ideas, because that's really where science grows.
Yeah.
It is, especially behavioral science. And, we have the little bit that we've done. And our hope, right, Kathy, is we've talked about is the fact that other people will take some of what we might suggest and run with it, because we're really just blazing over the top of a really wonderful topic. I mean, subject, I guess I should say.
Very cool. Well, thank you all. Any last things? Any words of wisdom? Are we good there?
Well, yeah. I hope if people have questions, whether from this Facebook Live or the little talks, and I hope you'll go listen to them, because I think they're fun, that we did, as well as our longer one, that if you would just get those questions out there, because that's going to be the exciting part. I think that's where the heart of the matter is.
Yeah, and I think the Q&A is going to be really interesting, because we hope it does generate discussion. Yeah.
It's definitely going to. So the event dates of June 25th, 26th, y'all, is where we're just reserving purely for Q&A. So you watch all the content first, and over the next 6-7 weeks or so, up until the 24th, and then 25th, 26th, purely Q&A. I'm excited to get some of the speakers chatting amongst each other as well. That's one of our personal goals. So cool. Let's wrap it up there. Thank you so much, y'all.
Thank you.
Okay. Thanks a lot.